do it on your own body weight. If not, to me or stool. So we're doing 15. So you're going 10, 15, 20 all the way up. So you're going for 15, 15 on each leg. Let's get started. 1. Go on your pace. 2, 3, 4, 5, 6, 7, 8, 9, 10, 5 to go. 1, 2, 3, 4, and 5. Swipe the sides, the other leg, same repetition. 15 reps. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 5 to go. 1, 2, 3, 4, and 5. Good job. Our third exercise, we're going to do some tempo pulse squats. Now, what I mean by that is that when we usually do our squats, right? When we're usually doing our squats, we more or less take a bit, like a second to go down and come back up, right? Si ndio? The tempo pulse squats tunataka tufanye leo. Tunaenda pole pole. So we're taking about 3 to 4 seconds on one single squat, okay? So you're gonna be here, and you come back up. When you come up, squeeze your quads, pin your miguu. Then go down, come up, squeeze those quads. That's going to be our third exercise. But remember, the rule dictates we start from exercise number 1. So we're starting from the lunges. Let's go. 10 reps. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good job. From there, tunaingia pistol squats. We're going for 15 reps. Are you ready? 15 reps. Good. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5. Good job. We change the other side. Remember, our exercises today, all of them, we're going all through. We're touching on the glutes, we're touching on the hamstrings, we're doing the quads, and we're finishing off with the calves. Okay? Let's go 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 5 to go. 1, 2, 3, 4, and 5. Good job. Good. From there, now we're starting with the tempo squats. Remember, we're doing 20 reps. Easy. Don't hurry. Take it down easy. Then come back up easy. 20 reps. Let's do this, okay? Good stuff. Let's go. 1, squeeze it in. 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good job. That's set number 3. We're starting on set number 4. Okay? So now, our set number 4, we're going to do the step ups. Let me demonstrate the step ups. You have your stool on the side. Okay? One leg will be on that stool on my chair. You're going to go up and down. Up and down. You can also step there and you step down. Step up there and go down. Still acceptable. Okay? So that will be our 4th set. But as per the rules, so let's do this. So starting again from the lunges, 10 lunges. Good job, let's go. 1, 2, 3. If you feel you want something to weigh you more down, you can have your dumbbells 4. You can have your kettlebell. You can even do the goblet squat, the goblet lunges there. 6. Okay. If you have a kettlebell, you can hold it. If you just in case you need some more weight. 7, 8, 9, and 10. Good. Are we okay? Let's do this. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 5 to go. 1, 2, 3, 4, 5. Woo! How are you feeling? Starting to take a toll on you? Let's push it. We can do this. The other leg, 15 reps. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 5 to go. 1, 2, 3, 4, and 5. Oh my! From there, go and get the top scoop. Okay. Shooting in for 20 reps. Are you okay? Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1. I'm imagining if I had a plate, I'll be on that motion. 2, 3. So in case you need some weight or just some additional weight, 4. You can be using a plate and you're in this motion here. 5, 6, 7. If you don't have me and you, we're still okay. Here, we'll do it. 8, 9, and 10. Good stuff. So then get a step up. Okay. I will do one last demo, just in case you've joined and you didn't see my previous demo. So you're stepping there, you go up, you can step up there, and you take the leg down. Okay, you can come up, easy knee, just give it a knee drive up, and you're good to go. So that's how. So, 25 reps on each leg. Hope you're good to go. I'm ready. Let's do this. 1, 2, 3, 4, 5, 6, 7, 8, 9. How are you feeling? 10. Push it. 1, 2, 3, 4, 5. 10 to go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Nafilaje mguu. So we change, we do the other leg, 25 reps as well. Alright? Let's do this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 1, 2, 3, 4, 5, 10 to go, 1, is that 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Ah! Woo! Perfect. Tunaingia set number 5. Now, set number 5 is where I had asked you for a book, okay? I will be using my mat. It's a bit thick, so I'll step on one end of the mat. Let me demonstrate. Just want to demonstrate. So, so we'll be doing the heel elevated narrow squat, okay? Heel elevated narrow squat. So your legs are closer in together, up. Okay, so remember, your heels are elevated because you're stepping on that particular book or that particular gadget that you have. It could be the plates, still as a gym. If you have them, you put them down, so you're stepping on them, or you have such a mat, but ensure that your heel is elevated. Hence, heel elevated narrow squats, okay? So you're stepping on it, your legs are close, not shoulder width. They are narrow, it's more of a narrow squat, okay? Then you'll go down all the way there, 90 degrees, then come back up. There, then come back up. Okay, that's our field exercise, alright? So get geared for it immediately after the step ups. That's where we're going to next. So now, as the rule dictates, tunaanza number 1. Are you enjoying the session? I hope you're having a good time. I'm having an awesome time. And thank you for joining me. So we still are starting again with the lunges. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good stuff. From there, I can still do it from this end. Tunaingia Piston Squat. Are you ready? Are you good? Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, and 5. You balance the other leg. Let's do this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, and 5. From there, tunaingia the pulse squat. 20 reps. Are you okay? Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 10 more. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good job. From there, you can get a step up. 25 reps. Okay? Let's do this. We don't have much time. And lazima tufanye the heel elevated. So let's do this. 25. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5. 10 more. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Balance the other side. Woo. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5. 10 more. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Give me your feedback. If you really loved it, you can repeat another different session of leg in the course of the week. Let's go here and stretch. We're out of time. Give me a nice stretch. There. Good. Here. Breathe. Good. The other side. Here. Twist your waistline. Ensure that you take a longer stretch than mine. Okay, you can proceed for a few more minutes. Kindly proceed. Hope you have enjoyed the session. Thank you so much for always staying tuned to NTV.
From far with you. I even gifted you a magnificent house. Rosa, it's the thought that counts. Please help me.
When it comes to fever, you need to be both. Panadol Baby and Infant starts to work on fever in 15 minutes and is gentle on the tummy. Panadol Baby and Infant, tough on fever, gentle on your child.
Ajali katika sekta ya bodaboda zinaendelea kuongezeka kila siku. Chanuka na Bodaboda Insurance imeletwa kwako na Chanuka Fintech wakishirikiana na Credit Bank na kuwezeshwa na M-Pesa. Kujisajili kwa Chanuka na Bodaboda Insurance, bonyeza *277#, weka shilingi 200 kila siku kwa siku 10, alafu ufuatilie na shilingi 50 kila siku kwa miezi 6, au ufuatilie na shilingi 300 kila Friday kwa miezi 6.
Hello, Susan. Yes, you. Holding that pack. I know you've been avoiding me because in the past I've made you uncomfortable. Maybe even caused you pain. But I want you to know that I have changed. For you.
Hey, what is this?
You can love me again if you're willing to give me another chance. Meet me at aisle 4. Hey, Susan.
It's lactose free!
You love milk, and now there is milk that loves you. With Gold Crown lactose-free milk, you can enjoy the richness of natural cow's milk without any of the digestion discomfort. Gold Crown lactose-free milk that loves you.
Credit to you if you stay at home. If you must shop online, use your NCBA credit card. Stay home. Stay safe.
Love garlic in your food but hate the hustle of making it? Introducing Fresh Fried Garlic, specially crafted with garlic oil for healthy living. The oil has a beautiful garlic aroma and adds an extra kick when used on your favorite meals. Fresh Fried Garlic combines wonderfully on salads, stir fries, marination for meat, or simply when sprinkled on your favorite dish. Try Fresh Fried Garlic today. Available in all leading outlets countrywide.
This is NTV.
And thank you for joining us on yet another week of exploring your world every morning from 7 to 9 a.m. Now, Tuberculosis, abbreviated as TB, is the world's leading infectious disease, killing around 1.5 million people each year, according to the WHO. Now, it continues to actually maintain that this is a reason it actually declared TB an epidemic early in the 90s. That said, Kenya carries its own weight, with TB said to affect over 169,000 people each year, according to the prevalence survey of 2016, and that number clearly with the years has changed. Those numbers could also have increased, especially in the face of the COVID-19 pandemic, and that is why today we turn our attention on the impact of COVID-19 on the TB epidemic. I will be joined by experts and also a person with lived experience with TB, so that we can also get to understand this highly infectious disease from a patient's point of view. My name is Gladys Gachanja, and this is what else you can expect on this broadcast.
It's not an easy journey.
Today, as I mentioned, we shed light on TB, the welfare of TB patients, and the impact of the pandemic on TB treatment.
Afya zao zimedhoofika sana.
Just how is malnutrition affecting particularly children suffering from tuberculosis? We found out. September 2020 marked the highest temperatures recorded in Paris in history. Court orders demolition of schools in Palestine that lacked construction permits. So today, as we focus on TB, our question of the day to you is, do you know someone or have you ever suffered from TB? What has been the greatest challenge in seeking treatment for TB? Talk to us. That hashtag is new normal on our social media handles. And remember, you can also call in or text us using the number at the bottom of your screen. But before we get to that conversation, let's take a look at the impact of COVID-19 around the world. And that number this morning stands at 37,746,051 confirmed cases of COVID-19. Now, out of that number, 28,347,330 have totally recovered from the same. And unfortunately, we have lost 1,081,435 people to COVID-19 in Kenya. That number stands at 41,546 confirmed cases of COVID-19, and out of those, 32,000 have recovered from the same, and we've lost 766 Kenyans to COVID-19. Again, I reiterate, there has been an alarm that has been sounded, especially in the counties, with a concern that the numbers of those that are infected seems to be increasing. So let's not let our guard down and let's keep vigilant. Remember, wash your hands, keep your distance, and of course, wear that mask. Well, let's take a look at that. Some of the stories making headlines across the globe, and Europe's top court has overturned a law Hungary used to close a college founded by George Soros in the latest clash between the EU and its increasingly authoritarian member. Soros, the 90-year-old Hungarian-born US investor and philanthropist, set up the Central European University in 1991, and in the following years, Budapest became the site of its main campus. An European Court of Justice official says Hungary, by adopting a law amending the 2011 National Law on Higher Education, 66 paragraph section 1A, that makes the exercise in Hungary of teaching activities leading to a qualification by higher education institutions situated outside the European Economic Area has failed to comply with the commitments in relation to national treatment given under Article 17 of the General Agreement on Trade in Services, concluded with the framework of the World Trade Organization.
Otse.
And looking at health matters, 12-year-old Noham has an autistic disorder. He should have entered secondary school at the beginning of the school year, but France's national education system has not provided the support he needs. His mother, our dear Roger, had to take time off work to take care of him. She says at the middle school level, I'm waiting for the principal to return with an Aish, a full-time trained companion for students with disabilities, so that he can eventually enter middle school. Without this person, he won't be able to enter college. Schooling in a medical educational institution has also been proposed to Noham, but none of the establishments in his department have a free place.
Et je me rends compte qu'on peut lui apprendre à dire les chiffres, à retrouver les chiffres et à faire de la lecture. Et ça marche. On fait 2 minutes.
Elsewhere, when we heard that news, we were very sad. That is, according to a Palestinian schoolgirl, after an Israeli court ruled that the Ras Al-Tinin school in eastern Ramallah was built without the necessary construction permit and rejected an appeal against its imminent demolition. Now, Sana Suleiman, a Palestinian student, says before the school was built, we used to study in a village, and when the school was built, it was a lot closer and better for us. The Jews came wanting to demolish it rather, and when we heard that news, we were very sad. The school principal adds that everyone here was happy with this school despite the basic and incomplete construction. And when the students came to the school, they were very happy, as if they got everything they wanted and more. But now, with the challenges we are facing due to the Israeli army and the settlers, our only wish has become that this school remains open.
Get it.
Well, speaking of schools, as you know, the Ministry of Education made a declaration that those who are in grade 4, those in class 8 and those in form 4 should actually go back to school starting today. Now, there has been a pull and tag with some parents rushing to court to say this needs to be stopped. But the ministry has been very categorical. It is time that the children start going back to school, even if it's in a phased manner. So what is the situation on the ground? Have you let your children go back to school this morning? Well, let's take a look at the situation in Murang'a County. We are joined by Martin Maura with the latest. Martin?
Well, good morning, Gladys. As you have rightly said, yes, students from this county, it seems like they're eager to go back to school. I'm actually live from Technology Primary School, which is at the heart of Murang'a town. And this, as you can see, it's almost like 90% of the students in grade 4 and class 8 have come back to school. They were supposed to be here by 8 exactly, but I'm being informed by the teacher that some minutes to 7, almost 60% was actually here. I just want to talk to the head teacher of this primary school, just to tell me how prepared are they because we have seen that some of the pupils, actually, if not all, have come back to school despite that we know there is COVID-19. Welcome to our set, Mwalimu. First of all, start by telling us how many number of students have reported back and what measures have we put in place to ensure that these innocent young souls are not infected.
Thank you very much.
Kindly put on your mask. Kindly.
Thank you very much. My name is Beatrice Wangari Washila. I'm the head teacher at Technology Primary School. This morning, as you can see, the learners reported very early. I think they were very eager to come back to school. So far, we have 99%, as you can see, at the back. We have already taken their temperature this morning, and where they are seated now, we are waiting for the medical health officers from our level 5 hospital to come and talk to them about the COVID-19 and how they are supposed to behave. For preparations, class 8, we have 96 learners. They used to be in 2 classes. Right now, we have spread them out to 6 classes.
We apologize for that technical hitch, but as soon as Martin Moore has his network sorted out, he'll give us more updates from his region. Now, back to health matters and further afield. Britain's health secretary tells Parliament that almost 16,000 positive coronavirus test results were not included in the reported daily case numbers over the last week, leading to their contacts not being told to self-isolate.
Video link. 15,841 positive test results were not included in the reported daily cases. This was due to a failure in the automated transfer of files from the labs to PHE's data systems. Mr. Speaker, this incident should never have happened, but the team have acted swiftly to minimise its impact, and now it is critical that we work together to put this right and to make sure that it never happens again.
One of the most crucial points in this pandemic, we learn that almost 16,000 positive cases went unreported for a week. That means as many as 48,000 contacts not traced and not isolating.
This specific issue.
Now back home and focusing on our conversation of the day, Jacinta Waweru shares her journey with TB from diagnosis to treatment and unfortunately the stigma it most often than not comes with. Here is her story.
I'm Jacinta Wangari. I'm 26 years old. I'm married. I'm mother of 1 kid. 2018, from October, now things changed. I started pain at the lower stomach. We went to North Kinangop Hospital. It's a mission hospital. I went to the physician, of which he sent me for MRI now. The good thing, after MRI, the results came. The doctor said, it is TB. I really cried because, you know, for me, I knew TB, if you have TB, you have HIV, you have STIs. I cried, and now I accepted myself and started taking drugs. Let me say, it's not an easy journey, especially if your parents are not supporting you, and if you're married, your husband is not supporting you. And us, we have to accept ourselves, because when you don't accept yourself as, now I'm sick, I have tuberculosis. If I won't take this medicine, I will give it to affect my husband, my baby. And you know, I have a small baby. Even me, I thank God, because those medicine, it's not easy, but because you know what you're going, what the result of the medicine, I had to take. Yeah.
Jacinta's story is one that resonates with so many people who get that TB diagnosis. And we'll talk more about it this morning, even as we try to understand the impact of the ongoing pandemic, that is of COVID-19, on the TB epidemic. And to help us have this conversation in studio, I'm joined by Dr. Elizabeth Onyango. He's the head of the National TB, Leprosy and Lung Disease Program at the Ministry of Health. We're also joined in the other studio by Dr. Lorraine Mugambi, who is the Chief of Party, USAID TB ARC2 at the Center for Health Solutions, Kenya. We are also joined virtually by Pamela Njeru, who is a community health volunteer from Tharaka Nithi, and also somebody with lived experience with TB. His name is Ben Ndegwa. Thank you all for joining us on this conversation. And I'll start off with you, Elizabeth. Why is it important as a country to keep tabs on how we're doing with TB?
First of all, thank you, Gladys, for giving us an opportunity to continue the conversation about TB. Yes, I can begin by saying that TB is an infectious bacterial disease that mainly affects the lungs, but it can spread and affect other parts of the body except the hair and the nails. And TB disease is spread from person to person through air. When a person who has TB coughs or sneezes or spits, they are able to expel the TB bacteria into the air, and if another person inhales the bacteria, then they may be affected by TB because we share the air that we breathe. Why is it important that we need to keep a tab on the fight against TB? Kenya as a country, we are ranked among the 30 high-burden countries in the world for TB, HIV, and multi-drug resistant form of TB. Every day, 400 people in the country fall ill because of TB. And every day, an estimated 90 people die due to TB. As a matter of fact, TB is the fourth leading cause of death among infectious diseases in the country. Yet we know that TB is preventable, it is treatable, and it is curable. So we should not lose unnecessary deaths, yet we are able to prevent them.
Okay, as we normally say, TB in a tiba. Now, in the time that we have seen the pandemic come and most people saying the symptoms are very similar between these two conditions, has that exacerbated the situation?
For us, we can say COVID and TB, they have overlapping symptoms. COVID presents with cough, TB as well prevents with cough, prevents with fever and chest pain. And their similarities have affected TB in a way. We have seen situations where the cough has been stigmatized and people are not presenting themselves to health facilities for fear of being tested for COVID. That happened at the beginning of the pandemic when it was not really clearly understood. But with the time, with the messaging that is going out there, the media campaigns, we are seeing that people are slowly trying to accept and getting into our health facilities. We know COVID has also borrowed a lot in terms of the principle and the strategies that they've employed from the TB control. TB has been there for a very long time. We've always talked about infection prevention measures, physical and social distancing, wearing of masks, which we encourage, the contact tracing that has happened, a history of having a contact with a person who has COVID, the same way we also look at the contacts of TB. So, and I can say that we see that COVID got a lot of attention, and in a way, TB was sort of, what I can say was sort of left by the wayside. We saw a lot of staff being repurposed, yes, to respond to COVID. And in a way, they were not available to provide the TB services at the beginning of the of the pandemic. We also saw a number of facilities that were closed, either because the staff got COVID and had to go to quarantine, or those facilities were turned into COVID isolation facilities. And so we can say that we were affected. TB control was affected at the beginning of the pandemic.
All right. Now, Lauren, let me bring you into this conversation. We just saw a release of a report the other day, actually, on the TB epidemic by the Kenya AIDS NGO consortium, and other global TB elimination stakeholders. And it was really zeroing in on the reasons or how the TB epidemic has been affected by COVID-19. From where you sit, what are those particular pillars of TB that have been affected?
Good morning, Gladys, and it's good to be here today. So looking at the different areas that the COVID pandemic has affected TB programming, some of the effects that we've seen at community level, that is patient level, is that because of the stigma associated with COVID, the fact that patients with respiratory symptoms have been stigmatized and people sort of look at them and think of them as being potential COVID patients, has resulted to patients having that shyness to present themselves to health facilities. So that's the first impact and effect. And as a result of this, we've seen a decline in the number of TB cases that have been diagnosed. When you compare the cases that have been diagnosed in this period of the COVID season and comparing it to a similar period last year, and that is at community level. The second thing we've seen is that because of the fact that health facilities were mostly focusing on diagnosing COVID, patients with respiratory illnesses would shy away from letting the healthcare worker know that they had respiratory symptoms, and sometimes would have patients with those respiratory symptoms once tested for COVID, and if they had COVID, then there would be issues of isolation, resulting to these patients not being screened and tested for TB. The other issue is that for those who have been diagnosed with TB and have been taking their medications, there has been a challenge accessing some of the health facilities that they would have normally gone to in order to access the drugs that normally they take. And because of this, we've seen some of these patients stop taking their drugs, and therefore adherence has been affected during this COVID season. Those are some of the issues that have affected our patients. And then within the health system, as Dr. Elizabeth has mentioned, we have seen healthcare workers being diagnosed with COVID, resulting to health facilities being closed, resulting also to health facilities that were initially TB treatment sites being reallocated for COVID work. And therefore, because of that, we've seen resources that would initially support TB programming being realigned and reallocated to COVID work. While that is good, because of course, when you have a pandemic, it's important to ensure that all resources are supportive of that pandemic. As health professionals who support TB programming in the country, it has been felt that we are likely, and we have in a sense lost some of the gains that we had made on TB programming in the past. So declining case finding, the unavailability of healthcare workers, health facilities for TB programming have been some of the impacts or effects of the COVID pandemic.
Okay, now clearly that outlines what we are dealing with, and earlier those graphics on air were just outlining some of those key pillars that Dr. Lorraine has actually mentioned on. And speaking of which, the social and economic crisis triggered by the COVID-19 pandemic is posing grave risks to the nutritional status and the survival of young children in low-income and middle-income countries. Now, Kenya is one of those countries that is adversely affected by malnutrition, and the pandemic is actually making things worse, particularly for children living with TB. Eunice Omolo was in Kitui, and she brings us this report.
In Isangwa village, Kitui Central, we meet Jane. She is the second born in a family of 9 children. She was only a teenager when she gave birth to her daughter, who is now about 4.
Nilikuja nikangundua ako na TB mwezi wa 5 mwaka huu. Ndio nikampeleka hospitali, akapimwa na akapewa madawa. Za mwanzo haikuwa sawa. Alikuwa amepunguza kilo kabisa. Alikuwa na miaka 4.5 na alikuwa na kilo 12. Alikuwa amepunguza kwa sababu ya hiyo ugonjwa.
She works as a house help and makes just enough to put a meal on her family's table and ensure her daughter gets the right foods to help her battle the infectious disease.
Kupata kazi ilikuwa ngumu.
She and her family live a modest lifestyle. They have no access to clean running water, which would help keep other diseases at bay. And with the country in the throes of the coronavirus pandemic, the burden just got heavier for them.
Shida niyo kupata chakula. Madawa konazo. Nadhani inakuwa ngumu. Juu ya maji ni pesa, sanitizer ni pesa, barakoa ni pesa, so kila kitu ni pesa.
Childhood TB is still a globally recognized public health problem. Children are infected either directly from an index adult case or from reactivation of a dormant case.
What happens with TB, because now it's like an opportunistic infection, especially for those who are co-infected with HIV, the nutrition needs become more, and that's why TB patients need to get food.
We all know the impact of that is that there is either wasting or lack of the necessary vitamins and minerals, and with that, then we also know the importance of nutrition in terms of whether you are put on treatment for HIV or TB.
Based on the cohort for 2018, we did mortality audit for our TB patients, and malnutrition was one of the key causes of death amongst our TB patients.
The pandemic has led to the closure of schools, and the closed doors are affecting children's nutrition, as the institutions were places where meals were guaranteed. In Kenya, about 500,000 children benefited from the school feeding program.
Since then, hata wakati mwingine nakutana na wao huko nyumbani njiani, naona afya zao zimedhoofika sana.
There's been a link between poor nutrition and malabsorption of key tuberculosis drugs, posing a threat and a challenge in the management and treatment of this deadly disease, especially among children. Eunice Omolo, NTV, Kitui County.
A report that actually focuses on the challenges ongoing during the pandemic. And Pamela Njeru is a community health volunteer in Tharaka Nithi. Pamela, what is the situation in as far as malnutrition or even the support of nutrition during the TB treatment and management?
Okay, thank you very much for having me today. I'm Pamela, and what I have been seeing about nutrition in Tharaka Nithi County, or even the larger parts of the country of Kenya on the patients of TB, is lack of food for the patients. Also for the food, for the malnutrition problem in Kenya because of the TB patients, the flood that were being given to them and the nuts were not available. And also because of the loss of jobs, if there was a house help, she was told to go home, she has TB, and she was not able to provide for her son or for herself to have proper food. The 3 types of food or the 5 types of food that she needs. For example, there's a mother who had a child. She lost her job. The child was was diagnosed with TB, and now she could not afford food for the child. The child has the medicine to take, but the mother cannot afford food. So the mother opted not to give the child the medicine. So that is a challenge to us as Kenyans to see what we can do for the patients of TB in Kenya.
And let me bring in Dr. Onyango. When you look at it from that point of view, because we cannot ignore the social economic impact of COVID-19 on everyone, and now more so the TB patients, how is the Ministry of Health supporting these patients?
Thank you, Gladys, for that. No TB in the country, in most of our private, public health facilities, selected private facilities, and even faith-based organizations. These ones are provided free of charge. TB screening, TB diagnosis, and even TB treatment. As much as we can, we avail the nutritional commodities for TB patients who are underweight. We measure them, and based on the scale, then there are those who are eligible for nutrition commodities. At the same time, we are able to link them to the nutrition counseling. Our healthcare workers are trained so that they're able to give them the nutrition counseling that they need, so that they keep themselves healthy during that period which they are also taking the medication, the TB medication, and beyond. In addition, all our TB patients, we ensure that we link them to the NHIF schemes, so that whenever they fall ill of other illnesses, then they can also be covered. Specifically for drug-resistant TB patients, there's some small stipend they are given just to cover the costs of like transport, and even to purchase maybe some food, just to assist them during the period which they are taking their medication. Yes, I know more still needs to be done, but efforts have gone to ensure that at least patients do not suffer such financial hardship as they access TB services. Yes.
Now we are talking about TB patients, and I think let's bring in somebody with a lived experience of contracting TB, and his name is Ben Degwa. When were you diagnosed with the same?
First of all, I want to thank you guys for having me on board. I was diagnosed last year, December. But before that, the symptoms started in late October, November. That's when I started experiencing drastic weight loss. And actually, one of my colleagues, he even noticed and told me, "You're losing weight." I'm like, I don't feel it, but it wasn't until I started having those fever and night sweats and losing weight, then I decided to go get a TB test done. And when they did an X-ray, they found out that my right lung was halfway with water, and they told me I have what we call latent TB. It wasn't showing on the cough or anything. I wasn't even coughing blood like the usual TB symptoms. So in my mind, all the times from October till December, I thought I didn't have TB. And it was a shock for me.
Okay.
To realize.
Now you had mentioned earlier that you had been misdiagnosed with pneumonia?
Yeah. At first, when I went to a local hospital where I stay at, they told me based on the symptoms, because I was experiencing cold and some sort of pain on my abdomen. They told me let's start you off with pneumonia, because they tested TB using the cough, and they couldn't trace anything. So we did that from late October till mid-November, but the symptoms kept persisting, even the weight loss. Let's say between October and December, I lost almost 15 kilograms. And when I went back, that's when they told me you need to get a TB test done. And I went to one of the facilities, government facilities, where I got tested. They did the X-ray and everything, and they found out I have TB.
Okay, now Dr. Mugambi, let me bring you on this one. He has mentioned a couple of things that we need to just seek clarification on, that he was diagnosed with latent TB, which makes it sound like there are other forms of TB. Please elaborate.
Okay. So, like Dr. Elizabeth mentioned, tuberculosis is a highly infectious disease that is spread, that is airborne, and therefore is spread when an individual who has tuberculosis either coughs, sneezes, laughs, sings, and someone else breathes in that air that contains the bacteria that usually cause tuberculosis. When an individual breathes in that bacteria, they develop what we call latent TB infection, which really means that in your body you have the bacteria responsible for TB, but it has not begun manifesting symptoms. And at this point, many times we come in and give this kind of patients TB preventive therapy. This is what we do for children under the age of 5 or persons living with HIV or other people or patients who may be considered at high risk for developing tuberculosis. At this particular time, when a patient has latent TB infection, they do not have TB disease yet, and they are not able to transmit the infection. Now, if your immunity, for whatever reason, say if you have HIV, if you have cancer, if you have any immunosuppressive disease, if your immunity is not able to handle that latent infection, the bacteria continues growing and patients begin developing signs and symptoms of tuberculosis. It's at this point that we say someone has TB disease. And at this point, someone will manifest with cough, like our patient may have, actually he did not present with symptoms yet, but cough, fever, weight loss. He mentioned that he had drastic weight loss, night sweats, that's one of the other symptoms, and also generally being fatigued. And for children, they may present with stunted growth, that is failure to thrive. They are not adding weight as they should, or even that they are not as playful as they normally would be. So these are some of the symptoms that would tell a clinician or a healthcare worker that a patient is likely to have TB disease. So we have latent TB, which is really an infection but not disease. We have TB disease, and then in some cases and in a few patients, we have drug-resistant TB. This is TB that is not responding to the normal drugs that we use for treatment of tuberculosis. Usually we use about 4 drugs in combination, and when these drugs are no longer effective and the bacteria that a patient has is not responding to these drugs that we use, then we say a patient has drug-resistant TB. So those are the different types of tuberculosis.
And when we come back, I'd like to get a clarification of exactly how somebody moves on to have drug-resistant TB. But that will be after we hear from my colleague in Mombasa County, Kevin Mutai, who's giving us an update on the back to school, which is today for the grade 4, class 8 and form 4s. What's the situation in Mombasa County, Kevin?
Well, good morning, Gladys, and we are joining the broadcast live from Star of the Sea Primary School here in Mombasa. And right now I can see there's quite a lot of activity going on. The students are already here, the pupils are already here, and currently the teachers are taking them through some training. I've seen that they're being trained on social distancing, how to wash their hands. And shortly before we got here, we also saw some of them, the temperatures being taken. Eager parents are also on standby on the other side, just witnessing what's happening here. This is a new normal. They never used to experience such kind of a thing before. Remember, it's been 6 months since the schools were closed after the coronavirus pandemic struck the nation, sending thousands and millions of students home with regards, as the government did whatever it could to make sure that the safety of the children are being being taken care of. But quickly, let me just interview one parent, and of course also get to hear from the side of the administration on the measures that they've taken in place. How prepared is the institution? And please kindly introduce yourself.
Okay, I'm Sister Ruth Musioki, head teacher of the C Primary School. I would say the school is ready to receive the children. Since last week we were called back, and the teachers together with the board, we prepared the classes to ensure that there is social distance in class, and also we have tried to fix some hand washing points so that when the children come, the first day we receive them, we say we are ready for now to receive the children, but most of the other protocols will be put in place as we continue receiving the children, because it was a challenge. This is a big school. We have 145 candidates, that is class 8, and we have 145 grade 4. So for us to keep the social distancing, you find that we have to occupy almost about 14 classes, and that means today we also have quite a lot of work, but we shall be arranging the children as they arrive, and the parents are here to witness, and I'm sure they are going to support us.
Have all your pupils reported today?
By the look at it, this is just a quarter which is here. But we hope, being the first day, there are challenges. Some parents are not sure. Actually, they have been calling, asking, are we coming? But I told them, let them bring the children to school, because the minister has already given directive that we start reopening the school. So I hope they are coming in slowly, and maybe by the end of the week, all the children will be here.
Okay, thank you. Let me also try and hear from the side of the parents. Definitely there are certain protocols that the government has put in place through the Ministry of Health, and the key on the list is the safety of the pupils. Are you okay with what you've witnessed so far?
Yes.
Kindly put on your mask well.
Yeah.
No, put it on, please.
I can see the whole protocol has been driven. I can see even the kids are quite in numbers here. I can see all the protocols. I can see the hand washing. I can see the staff they see has prepared themselves.
So are you satisfied as a parent?
Yes, to be honest, I can see people. The staff they see are ready for to receive the kids, and they are ready to learn. I can see even the kids themselves. They are tired. Being at home, I can see they're having a big challenge here. The challenge is that they are ready to learn, and the issue is here. While we are coming here, I can see most of the kids, they have left their mask at home. So us like good parents, we have decided to bring extra masks. We have masks here, whereby we can supply to the kids. At least they can start with their education properly.
Thank you so much. Thank you so much. Well, of course, it is also worth noting that those pupils who will get here and record higher temperatures, then definitely they will not be allowed to come into the institution. But of course, also we've had reports from the region whereby in high schools we've had students from Form 1 to Form 3 have been called to go and pick some of their belongings, because they're only Form 4s who are allowed to go into school. But of course we'll be doing a spot check even into the bus parks to just try and witness and see how many students, pupils are coming in from other parts of the country. But of course, remember also COVID-19 is still here with us, and Mombasa is one of the counties that has been recording highest numbers of the coronavirus infections, with the county even being at one point placed as an epicenter for the virus, coming second after Nairobi. But we've witnessed at some particular time the caseload went down, but again it's picking up. So with concerns even from health authorities indicating that we might be heading into the so-called second wave. But we will be doing a spot check on different learning institutions here in Mombasa, and again keeping an eye on what's happening across the coast region. And definitely stay tuned to NTV. We will be updating you on this, about everything about this first day when pupils are reporting back to school after more than 6 months at home. Back to you, Gladys.
Thank you, Kevin Mutai, speaking to us from Mombasa County. And yes, we'll keep a spot check on the back-to-school activities, even as grade 4, class 8 or grade 8, and of course, Form 4 students go back to school on this 12th day of October. Now, back to our conversation. And before we crossed over to Mombasa, we talked about drug-resistant TB. And I'd like to understand from your work on the ground as a community health volunteer, Pamela, what are these circumstances that lead to patients having to deal with drug-resistant TB?
Most of the patients are the ones we go around, we screen them, we go for treatment, but after starting treatment for 2 months, maybe she or he goes away, he defaults or she defaults from taking the medicine. We go back to the home, gets him or her back to the hospital. He or she again defaults from taking or interrupts the medicine, taking the medicine for some time again. So after that time of taking the medicine and then again not taking the medicine, running away from treatment, that one causes the problem of getting the MDR that makes most of the patients, because of maybe ignorance or not understanding why they are taking the medicine, or also the challenge of taking so many medicines that maybe he or she is HIV positive and she has TB. She's taking this medicine of TB, taking the medicine for HIV. Then the load of the medicine makes him or she feel is not going to take the medicine again. That's why most of the times running away from medication makes it hard for them to be healed. And then they get the MDR, which is also the challenge when you visit homes. Most of them run away. You have to run after him. You go to the chief, report to the chief. I have this case here. Can you help me take back this person to the hospital for treatment? Sometimes they run away and go to another county. So you never know where he or she went. Then after some time, he or she come back. And then after that time, she or he has spread the TB to the community.
Pamela, let me understand. Pamela, let me understand. Why? What is the reasoning behind running away from treatment? What do they say is a reason?
Most of the times, they refuse.
Why?
When you tell them they have TB, sometimes they reject. They say, no, I don't have TB. No, in our family, we have never gotten any person with TB. For me, I don't accept. So he takes the medicine, go with it at home, and just keep it somewhere. So why you think the person is taking medicine? Is not. That is mostly rejecting, not accepting that their status, that they have TB.
Okay.
Yes.
And speaking of which, Ben, you said you just finished your treatment of TB in June of this year, and it has been said over and over again that men have the worst health-seeking behavior. When it came to adherence of that medication, were you disciplined enough?
Yeah, you know, when they told me I had TB, the very first thing that came in my mind was my kids, my family. I'm like, wow, I just couldn't believe it. So immediately I knew a few things have to change. I just have to be disciplined enough to take the medication because I knew the consequences. And my diet was okay, but I have to maybe improve on the diet. I love red meat. So that one thing I had to change. And the amount of medication I was about to take, that's the most I've taken in my life. I personally don't like medication. I'm a type of guy, when I get sick, I try to do my own little things to get myself better. But I knew it was going to be a long 6 months journey for me to finish up the medication, but I had to do it. It was tough. I'm not going to lie to you. but with the help of my family, I had to do it for not only for my own sake, but for their own sake. So if anything, just because even when they told me I had latent TB, back in my mind, I was like, maybe I've infected my kids or even my wife. And it turned out not to be. Thank God for that. But,
okay. And Ben, most of the patients will also say the reason why they shy away from hospitals or even going to get the medication that is given on a weekly basis is because of a stigma that comes with being diagnosed with TB. Did you face any of that?
No. I didn't face it, but you never know, because even when I was told I had TB, in fact, what they do, they do an HIV test on the same day. The moment they realize you have it, so you have to do, so they can know what type of treatment they will program you under. And from then on, once they find out whether you're positive or negative, then they curtail the medication for you. And yeah, I mean, I never faced any stigma, but you know, when I was telling some of my friends I have TB, you can tell even their reaction, like, man, this dude probably has HIV or something. And even those who knew me, losing all that weight, like I said earlier, 15 kilograms in a span of 2 months, that's a lot of weight. So they probably put 2 and 2 together, but thank God I was okay. I just had to follow the treatment and get down with it, or face the consequences, because they had told me if I failed to take the medication consistently for 6 months, then they will do another form of aggressive treatment where I have to go get injections every day for another 8 months. So I didn't want to go through, you know.
Okay. All right. Now, Elizabeth, I could see you smiling because I'm sure you've had these stories over and over again. But talk about how stigma can actually fuel the trajectory of TB within the communities, because the patients just shy away from treatment.
Thank you, Gladys. We say stigma is real. And for TB, we have really tried to fight this battle over decades, and we thank some of the organizations that we have, like Stop TB Partnership, a network of TB champions, those who are former TB patients. They've come up and actually advocated and created awareness on TB, so that the stigma is reducing, maybe not to the level that we expect. But what Ben has said is actually real. There is that connection. If I have TB, most likely I have HIV. But we should not actually stigmatize the two diseases. HIV currently in the country is manageable. We just need to present ourselves to have that test. Then you can access the ARVs. It's good. Currently, we have the test and start. It started on ARVs, and we are having people who are living even longer. So stigma is real, and especially when you have the cough, and this cough also crosses over to COVID. We have people, okay, they've tried to manage that stigma related to TB. They want to present themselves to facility for TB testing, but again, there's this other fear of COVID that is coming in and acting as a barrier. So as a country, as a community, the message has to continue going out there. We should not stigmatize the diseases. We as healthcare workers, we are prepared at whatever level to handle the disease conditions that are out there. That is actually our work. So we should stop the pointing of fingers or the whispers that go around just because somebody maybe has lost weight. So if you also notice you're losing weight very fast, please present yourself to a health facility. Yeah, then you can be attended to.
Now, before we take another short break on your world, just emphasis on how you can suffer from drug-resistant TB. Pamela touched on some of them, which is, you know, denial that you have the condition and not taking the medication as scheduled. What are others?
Yes, drug-resistant forms of TB can occur as a result of many things. I'll just mention also a few. One, we know that any living thing strives to survive. Yes, and also strives to thrive. Also the bacteria, the TB bacteria, as it sees something that is endangering its survival, it will try to change its behavior. So that's what we call mutation, so that the drug is not able to really hit the bacteria as expected. Again, we have other reasons like not taking the appropriate medication. We know to TB standard treatment, we have a combination of 4 drugs to start with in the normal treatment. But in a situation where people are not following the standard protocols or procedures of treatment and maybe uses only one drug to treat the disease, then resistant patterns are likely to spring up. Also, when we have substandard medication, yes, those that will also not be effective enough to kill the bacteria. She mentioned about treatment interruption.
Yes.
Yes, so no, not really taking medication but not completing the whole course of treatment. It might kill a few bacteria, but not some will still survive and maybe try to mutate. So there are a number of reasons, and again, sometimes it is not that you progress from drug-sensitive TB to drug-resistant TB. We have a situation where if somebody inhales germs, actually the bacteria that is resistant to the normal medication, then you just get the resistant TB at this instant.
Okay.
Yes.
All right. We're about to take a short break on Your World, but when we come back, I'd like to understand something that was put across in 2016 during that prevalence report and survey that was released, that there was concern about TB amongst the adolescents and the young adults. Why? That question will be answered in a moment, and especially now that we are opening schools, it will be interesting to hear that perspective. But before we do, I hear you're talking to us. We had asked you on the question of the day, have you ever suffered from TB, and what were the challenges accessing treatment? Well, Afax Roti says, I was a victim in the year 2012 while in college. Went to Chogoria Mission Hospital in Meru and was given those tabs fortnightly. Finished my course successfully through though my ears were affected, partially deaf now, even having been reassured of return to normalcy, transferred to home hospital to continue picking meds without a hitch. I think the people I met know their job. God bless them, but my ears. Polisana for that. Richard Chesire says, I'm one of them. The greatest challenge I faced was the drugs. 9 months using drugs, but all in all, God is really good. Lily Pona. Richard, we thank God for you. Mercy Myra says, I'm a victim 2 times. After 2003, took medicine for 6 months. I got cured. After 10 years, I got infected again. I was injected for 2 months, which affected my mobility, and drugs for 9 months. It was the hardest time in my life. I thank God I recovered completely and my mobility is back to normal. Well done, Mercy. We thank God for your recovery. Eric Onyango says, yes, my sister, she took the medicine for 6 months and was cured, but she is now well. Thank you, Eric, for sharing. Paul Munyiri says, I was a victim in 2013, fully recovered now after completing the treatment, but unfortunately I lost my job as a result. Interesting, and pointing to the stigma that comes with it. Wanjogo Mwangi says, yes, my brother, the biggest challenge is while we are told treatment is free in all government hospitals, many times there's not any left with we are not left with no option but to buy, meaning also there is a problem with the stock of a medication, and Dr. will talk about it. Maurice Molwa says, I got it and recovered. The nurses were so rude. Pole sana, Maurice, and thank you for sharing your journeys and those of your loved ones. And we shall come back to hear more from you and, of course, understand more about the effects of TB, and definitely especially during this pandemic. Stay with us.
As we take personal responsibility and adhere to all government regulations and guidelines in relation to coronavirus, may we remember that God is faithful. He will not allow us to be pressed, crushed, and perplexed by the epidemic to a point of total destruction. 2 Corinthians chapter 4 verse 9 teaches us that we may be hard pressed on every side, but shall not be crushed. We can be persecuted, but shall not be abandoned. We can be struck down, but shall not be destroyed.
Here at NMG, we are working very hard to ensure your favorite publications, Daily Nation, Business Daily, Taifa Leo, and the East African are readily available. In a bid to support the efforts to prevent the transmission of COVID-19, NMG has ensured our staff, our distributors, and their staff adhere to set guidelines. At our printing plant, all staff are required to wash their hands before entering the factory and must be wearing a mask. All workers either change their clothes on entering the factory or wear an overcoat. We are keeping doors open to avoid our staff touching door handles repeatedly. With our automated printing, contact with the newspaper is kept to a minimum, and at the packing process, the staff observe social distancing. Vehicles used to transport the newspapers are disinfected daily before the newspapers are loaded, and our delivery staff all wear masks and wash their hands regularly. Our vendors ensure that they sanitize every time they handle money and wear their masks at all times. NMG is proud to be able to safely meet your information needs. Stay safe, stay informed with our favorite NMG publications.
Along came one.
It looks like Luciana is sticking her nose into things that are none of her business.
This isn't the right time.
He was always after me and everything was just going great until Marta got in the way, just as she did with your father.
If there's anything that concerns my children, you have to tell me about it. Do you understand?
Excuse me for interfering, but if Luciana didn't...
But still, she doesn't have any right to keep from me anything that has to do with my children.
Yes, but...
I don't even want to think about how much trouble she's in.
Luciana, the fact that I can't be with you doesn't mean that I can just forget everything I feel for you.
Are you alright, Madam Lillian? Is anything wrong? It's nothing you can fix. Nobody has the cure for love problems.
Along came love, in association with Blue Band Peanut Butter.
Taught us, sallallahu alayhi wasallam, that we should keep cleanliness. Actually, he said that cleanliness is what is best for a Muslim. And from him, Prophet Muhammad sallallahu alayhi wasallam, hand washing, which is part of cleanliness, hand washing, that we wash our hands, we wash our faces, we wash every time with soap. This is part of what the Prophet sallallahu alayhi wasallam taught us.
Get an 8-acre prime residential plot with soil merchants in Kisamis along Magadi Road at 148,000 Kenya shillings for cash buyers or 195,000 Kenya shillings for installment buyers.
Come to our open day on 17th October.
Thank you for staying with Your World. My name is Gladys Gachanja. Today our focus is on tuberculosis, the impact of COVID-19 on TB. But before we get back to that conversation, let's listen in on the ongoings in as far as back to school is concerned. Remember, the Ministry of Health gave a directive that grade 4 students, grade 8 and of course Form 4 students should go back to school on this day, the 12th of October. So what's the situation in Nakuru County? Bridget Ngana now joins us.
Well, Gladys, it is a very busy morning this day here in Nakuru County. We are at the Moi Primary School, a public school for that matter, and already parents are already bringing in the pupils into school. Remember, the Ministry of Education directed that grade 4, class 8 and Form 4 pupils and students are supposed to resume learning today. And we are going to speak with some of the parents who brought in their pupils to learn this morning. The management of the school has said they cannot speak with us at the moment because the current head teacher is in acting capacity, and there's a circular from the Ministry of Education that they would not supposed to speak to us. But let's just speak to the parents. Sema tu majina yako na utueleze kwa nini umeamua kuleta mtoto wako leo, na unajua wakati huu bado tuko na janga la corona.
Okay, kwa majina naitwa Mary Kimani na mimi ni mzazi wa hapa. Mtoto wangu ako grade 4. Na kulingana na vile serikali ilisema wanafunzi warudi shule, niliona ni muhimu na ndio maana yuko hapa leo. Nimemleta yeye.
Umeridhishwa na vile umefika darasani pale na pia umeona vile wazazi wanakaa?
Okay, kulingana na vile nimeingia kuanzia pale kwa gate nimefika na nikapata kuna wamejipanga, kuna maji na kuna tumepimwa na kwenda pale class tumepata walifumigate na sasa ni tumeambiwa classes zinaanza tu officially.
Una hisia gani kama mzazi? Una fears mtoto wako anaweza pata corona ama bado unajua tu serikali itawashughulikia shuleni?
Okay, naweza sema kuna changamoto kidogo kwa sababu ikifika kwa classes hatujui itakuwa vipi na pande wa transport, kwa sababu tunaona kama distancing itakuwa ni changamoto kidogo, kwa sababu ukiangalia maybe kama shule kama hii yetu iko na bus moja na inaweza kuwa maybe ni changamoto kwa sababu watoto wengi wetu hapa wanatumia public transport. So sijui itakuwa ni vipi. Ndio.
Pendekezo lako pengine kwa serikali sasa wazazi wakirudisha watoto shuleni?
Sasa sijui itakuwa vipi kwa sababu naona changamoto ambayo yenye iko ni maybe upande wa transport peke yake. Ndio.
Sawa, asante. Let me speak with another parent. Karibu, tueleze tu umeleta mtoto wako ni wa darasa gani na umeridhishwa na hali vile iliko shuleni sasa?
Mimi ni kwa majina naitwa Esther kwa Mkabeli. Niko na mtoto wa grade 4. Nimemleta, ninaona shule iko sawa. Naona wako sawa.
Sasa wazazi wanafaa kwa mmerudisha watoto shuleni. Tueleze kama wewe unajua wataweza kusoma kama kawaida ama umewamsaidia pia kusoma nyumbani?
Although tumewasaidia kidogo lakini walimu wanasaidia hata wako sawa.
Sawa, asante. Acha tuzungumze na mzazi wa mwisho. Karibu sana. Tunaomba tu nafasi kidogo tutamaliza. Haya. Majina yako na tueleza vile umeridhishwa na hali ya shule sasa.
Kwa majina ni Wilfred. Mimi ni mzazi wa Izure. Mtoto wangu ako grade 4. And viona vile serikali ilitangaza, viona ni vizuri nilete mtoto wangu.
Pendekezo lako umeridhishwa, unajua kama watasoma vizuri ama what are your fears? Una hofu kama wataweza kukava syllabus kwa hii muda imepewa na serikali?
Nimeona tu shule imejipanga vizuri, naona maji iko na walimu vile wanaelekeza watoto naona wanawapanga wafuate social distance. Kwa hivyo naona iko sawa kabisa.
Gladys, let me just tell you, like, we're being chased out of the school right now. The security man is just behind us. He's pushing us out. He's telling us that we're not supposed to be here. Remember, this is a public school. And just to point out something, this was also an isolation facility here in Nakuru County, and it has been fumigated in readiness for the reopening of schools. I have not been able to even exhaustively ask the parents the questions that I want to ask them because I'm being told to move out of this place. I did seek permission from the acting head teacher at the school before even we went on air, and she said she's not in a position to speak with us, but I requested for us to just see the school as it is, the situation on the ground, and just give Kenyans a real picture that people are going back to school, because this is a public school for that matter. But at the moment, I'm being told to move out of here. But we will head on to other schools. We're still doing a roundup from here in Nakuru County. So do stay tuned. And right now, let me just try and move out. He's gone back to the office. I think he's just going to look for more reinforcements to just chase us out of here. But the roundup continues, and we will be giving you a clear picture of what is happening here in Nakuru County on this big day that public schools and schools in general in the country are resuming operations.
A day in the life of a journalist. Bridget Sungana, thank you for that report in Nakuru County, and we'll definitely be crossing over to you and many of my colleagues across the country to give us an update on the situation in as far as going back to school is concerned. Back to our conversation of the day. And Lorraine, according to the first post-independence Kenya TB survey, prevalence survey that was done in 2016, it actually highlighted that there was a concern on the prevalence and impact of childhood TB in children between the age of 0 to 14 years. Why is there a concern in this age group?
Okay. Thank you, Gladys, for that question. And I know at this point it's a question of interest, particularly with children going back to school. So when you look at the age groups, the different age groups for our children and the TB situation, between the age of 0 and 5 years, children generally have a very low immunity, and during this time they are very susceptible, or it is easy for them to be infected with tuberculosis, particularly if they live in close proximity with an adult in their vicinity who may have TB disease. And so children between the age of 0 and 5 many times will be infected by tuberculosis, and mostly that transmission is either by parents who they live with or other caregivers within their vicinity. Then as the children grow up, their immunity improves, and we find that many children, the prevalence of tuberculosis for children between the ages of 6 and 14 starts declining. However, when we approach the adolescent age group, we find again that prevalence increasing, and it is theorized that this is because at this time, because of the hormonal changes that take place, the risk of infection is higher for this age group. And then number two, because of differences or changes in their socialization, whereby they are now in school, some are going in boarding schools, where sometimes it's overcrowded. And then, of course, they've moved away from the home setting to other social situations where there is likely to be that infection. And so there is an increase in the number of children, particularly in that adolescent age group, who start getting infected with tuberculosis. And then again, now when we move to the young adult age group, that is the age group between 25 to 34, what we find when we look at our epidemiological data, that is the data from our TB surveillance systems, we find that men and young adults, particularly in that age group, seem to have a higher prevalence of tuberculosis, number one. Number two, the risk of non-adherence, that is, if you're on treatment, that risk of not adhering to your treatment seems to be higher. And then for men in particular, they seem to have poorer health-seeking behavior, and particularly in this age group. So those are some of the findings that we saw in the Kenya National TB Prevalence Survey that was conducted in 2016, highlighting the care-seeking behavior of the different age groups, and also the prevalence of TB, particularly the fact that TB is more prevalent in men, it's more prevalent in the age group 25 to 34, and it is more prevalent in the urban settings such as, you know, Nairobi, the informal settlements, congregate settings such as schools, such as prisons, and such like, overcrowded areas.
Thank you, Lorraine. That is a very good description of exactly why this is a worrisome age group. And Ben, again, you've had men have been mentioned to be quite a worrisome demographic. And I'm wondering, from your experience being diagnosed with TB and conquering it, has it also instilled a change in your own lifestyle?
Yeah, at some point, because for example, I'm a social drinker. I mean, I don't drink every day, but it made me understand the kind of change that lifestyle of drinking, however frequently I used to do it or not frequently. And also, I don't smoke. I'm not a smoker. So that was an added plus in my case, because from what I used to hear, if you're a smoker, you're susceptible to get TB, or you're more likely to get TB or even not get cured from it. So that aspect of my life I had to change, and then concentrate on eating right. And by this I mean if it's diet, I had to change from red meat to white meat, more cereals, legumes, veggies, and all that, just to stay healthy. My goal was to just get down to 6 months and get back to my normal life.
Okay, now we hear you, Ben, but I have to stop you at that point because I'm being told that the CS for Education, Magohe, is speaking on the resumption of school today.
Hereby, both genders wearing beautiful masks. Good morning once again. It gives me great pleasure to be here this morning, having started elsewhere in other schools, but coming here now to see this very large number of children, 730 odd candidates sitting for the primary school exam this year. The progressive reopening of schools to face-to-face learning commences countrywide this morning for grade 4, class 8 and form 4 reporting to their respective institutions. As you are all aware, learners will reopen for term 2 of the academic calendar. The Ministry of Education has released health and safety protocols for the implementation by all learning institutions in readiness for the resumption of face-to-face learning. I'm happy that schools have worked very hard to comply, and the schools I've been to this morning have made me very happy indeed. I have also repeatedly said that although physical distancing shall be and shall remain a challenge to us, it should not, and I've been reassured by the teachers, that it is not going to be a bottleneck to our resolve to open our schools for our beloved children. I encourage schools to engage with students to build confidence about COVID-19 preventive measures, and I'm glad to say that I've seen multiple water points in this school, but I've still demanded for additional more especially when we shall reopen now for the other over 3,000 students who are still at home. And I want to say that this morning at the Nairobi Primary School, I found a phenomenon which was very strange. The grade 3 children, some of them had come to school, which means the other children are itching to come to school. And as we ask ourselves, we have opened now for just about 3 classes. I think we should be bold enough to continue to observe them for about 1 or 2 weeks before we decide as to whether we can risk having larger numbers. So for those parents who are unable to convince their children, I would like their children to listen very carefully, that actually it is because of our great love for them that we want them to remain home for a shorter while we see what happens when just a smaller number is back at school. And by the grace of God, we shall recall them when the time is right. I also urge principals and teachers to compile a list of learners with pre-existing conditions. For example, asthmatics, if there are children who have asthmatic problems, and any other pre-existing conditions, so that the necessary attention can be given to them in line with the health institutions that you have aligned yourself with. Schools must ensure mandatory use of face masks, monitoring of body temperature, and I have seen that for this school, which is perhaps the largest primary school in the country, all those issues have been adhered to. I want to thank the Kenya Commercial Bank, which is our own bank, and to state that I think Mr. Ogara has some futures which look like me, because I did not believe that he would have made the masks, because I only went to his office to thank him for some benevolent act that he had done some early in the year. He had sponsored 50 students, and in that meeting he says he's ready to sponsor another 100. But then I said in passing, because I didn't want to look I didn't want to look like Oliver Twist. I said that, but we are also looking for masks. And he said, oh, I will give you 1 million masks. I said, how I wish I had come earlier. I said, just give us the specifications. And since we had developed a mask with Dr. Ombajo from the Ministry of Health, the infectious diseases expert who had developed the mask, and since I, as Magoha, don't trust anybody, we went with Dr. Kipsang after several meetings, and we went proudly to 3 government outlets. One of them is Kikotek in Kitui, the other one is the National Youth Service, and the third one is Rivertex. And we intervened and talked to them at length and negotiated the price. And the price at Rivertex turned out to be the lowest at 35 shillings, Kikotek 39 shillings, and I think the National Youth Service at 59 shillings. Those are government institutions. So what Ogara has done is he has moved faster than me, and I think they have made masks, because I can see these children wearing the masks, which means they were made and brought. So can we give a very hearty clap for KCB to act as an example, even to my own ministry, where officers in the field sometimes are not as swift. If it can be done, I believe we gave you the letter not up to a week ago. It's not up to a week ago. Rivertex has the capacity, because I have been there, I can say it, and if you don't like it, go to that other place I always say. It has the capacity. Do you get the point? It is a government agency, and therefore there is no fear of you going there. There are others who offered earlier to give us some masks. But up to now, even the procurement processes have not been complete. So for this purpose of reopening, they may not help. They perhaps may help when we reopen the other one. I want to plead and challenge other corporates that in Kenya, the standard, the gold standard is these 2 children here. We are opening schools for them. If you can't open schools for them, the government will not open schools for any other person. So they are the gold standard. May I ask the other corporates to move with us in tandem? Since I have said that social distancing is going to be a challenge, every child must be safely masked. And so, Mr. Ogara, I hope you have given an example to your other colleagues, and that it is also better this way, rather than giving us money, because once you give us the money, then we are tied by procurement processes which don't make sense, and which some people will always utilize for other things. But if anybody wants to help us with these masks as quickly as possible, you have Rivertex, you have Kikotex, and you have the National Youth Service. If you want a point of contact, I am your servant, contact me. or my person who is in charge of the media, Dr. Siringi there, or Dr. Belio Kipsang, because as we prepare to open all schools, we are going to need more masks for the less fortunate children. Schools shall maintain updated biodata for all learners and staff and contacts of their parents and guardians in terms of, so that we should be able to relate to emergencies. But I would want to say this as a practicing physician who is on leave. Should there be an emergency, every parent and every teacher shall be a guardian for that time. We cannot wait until you finger the parent. This is our own African culture that unfortunately is dying. So I'm not worried if a child requires help, one of the teachers will automatically become the guardian and the parent, and the others will follow. Because even when my own son had an accident, somebody represented me and secured him and took him to hospital, and he's now paying back. So I'm not quite worried about this. I know for sure that people will argue. In the training of teachers, we are trained to be empathic. What we don't know is that we are all counselors. Can you put yourselves into that mode so that you go the extra mile and help our children? During this period, at the beginning, take time also to interact with them so that the anxious ones can be brought down to the level. I'm going to plead with all parents and school heads, both principals and head teachers, and all the teachers, that unless a child has a pre-existing condition, unnecessary school visits by strangers should be voluntarily toned down for the time being. I am assured, and I've been assured, that all schools have been linked to health institutions. And this is important because in the event that you suspect that a child has fever, the fever may still be from malaria or any other condition. But the important thing is to be able to confirm that as quickly as possible. And if it is anything else, then the public health regulations require that we are informed as quickly as possible, and the government of the Republic of Kenya will do what it takes. Each school shall constitute a COVID-19 response committee and maintain strong networks within the nearest health facility. In simple terms, you have to get your own ways of procedure. For example, this huge school, the staff should sit down and identify which is the best way to react quickly if there is a situation that requires an attention. And our doors are open. Dr. Kipsang, our doors are open to them. Co-curricular activities and school assemblies, with all humility, should be restricted, taking into account social distancing protocols. Have I said that in simpler English, or you want it better? Avoid amassing all the children together for any purpose, unless it's a matter of life and death, for the time being. For example, if you want, if there are 10 teachers and a large school like this, you can have 10 different points to see the children. You don't have to bring them all together. Because if you bring them all together, you know what may happen. But still, you are the head teacher, and you must run the place. I want to end, first of all, by re-emphasizing the government's resolve to ensure that as our children come back to school, they are kept in a safe environment. I would also want to urge the rumor mongers and people who just look at negatives and keep hammering them, that these are our children. They are not monkeys. And now that we have decided we are moving forward with them, ours should be to encourage them and not to discourage them. And I'm charging everybody, and I believe everybody is related to a child, that from now on, can we have positive thinking, and that if there's a problem, as you point out the problem, also help us to solve it. To our teachers, our gallant teachers, the success of the step that we have made, which is being assisted by other external publics like KCB, shall only succeed if we put everything in what we are going to do. Nobody shall be able to compensate you. We are going to expect that you go the extra mile. We are going to expect that you work overtime without pay. And that is what's going to happen to everybody for the time being. And you are not doing it for the government, you are doing it for our children. So I want to thank you most sincerely once again, Mr. Oigara, and also to hope that by the time the day is complete, maybe I may find 1 or 2 phone calls, and if you see me in your office, it doesn't matter. For us, where we have reached now, even if you give us just 100,000 masks, we shall be grateful for them, because you can see that I can go and rest, because these guys are masked. The place is too small. The government policy was to ensure that everybody is at school. That policy has not changed, and is a very good policy indeed. And you are aware that the policy of His Excellency the President of 100% transition required that we go to the public and even get those girls who gave birth 3 years ago and take them to school, and that's what we did. For those children who may be pregnant, as we deal with the criminals, may I assure them that they have nothing to fear. They should come back to school. Teachers should be very, very empathic with them, giving them all the assistance. And when the time comes, they should be given the opportunity to go and give birth. And after winning, they shall come back and continue with learning. I want to leave it there. I will not take any questions. Perhaps just one thing about school fees. I have said that as we comply with the government requirements, for those few who still have to pay fees, primary school is free, so there's nothing like fees. Day secondary schools are free. But for the boarding schools, where boarding charges are charged, may I once again plead with our principals and head teachers to ensure that no child is sent home on account of school fees, both in the private and the public sector. Because people think I keep talking about public. Even the private schools. Finally, for the private schools, where some people have tried to equate reopening with those who had online classes, we want to make it very clear that all children will start from where they left. All children will start from where they left, and like I've said, the gold standard are these two. So even if you make so much noise, if you send a child home because the child did not engage in online classes, that is criminal, and we shall come for you. The fact that it's a private school does not protect you. And I'm going to ask the leader, Mutheu Kasanga, to ensure that as we open, nobody takes advantage of the children. Let us be empathic with the parents, and no parent should be ashamed to bring the child to school, because that's where I want them. Thank you very much, ladies and gentlemen.
Thank you very much. Yes.
Well, Well, that was CS Magoha giving us a brief on the resumption of education on this 12th day of October. Remember, the schools are back, at least for the grade 4, grade 8 and Form 4 students. He has stipulated an outline of some of those conditions that have been put in place to ensure that all and sundry are safe, but of course to ensure that we also keep an eye out for any infections within the learning institutions. Now, let's cross over to Gabriel Kudaka, who is giving us an update on the situation in Eldoret.
Thank you so much, Gladys. We are at Wasingishu High School in Eldoret, where the school has about 300 students who have already reported so far this morning. And right now, I'm talking to the deputy principal of this school. How are you, sir?
Fine. My name is Joab Kasi. We have opened in earnest. We have 300 students. All of them have come, and we're having our first opening assembly. We are ready to go. We have been hungry, waiting for this time, and we are ready to go. We have taken all the measures that the Ministry of Health requires us to do.
Have you put in place the measures of safety guidelines? Measures are in place?
Yes. There's the washing areas, the thermometer, the thermoguns rather. They are all there, and we are really set to have the students begin their lessons today.
How are you, madam?
Fine.
Yeah. In terms of masks, do they have enough masks? Where do they get them from?
No, they've actually come with their own masks because the ministry has not provided us with what they promised. But so far, so good. They've come with their own masks.
Okay, thank you so much. How are you?
I'm fine.
It's been 6 months since we went out of school due to COVID-19 pandemic. How do you feel coming back to school right now?
Yeah, we are set, we are ready, and we are ready to excel as candidates and do what we have to do.
Okay. Before I hand over to you, just one more. How are you?
Fine, thank you. How are you?
Back to school?
It's kind of terrifying, but honestly speaking, we are glad that we came back to school to continue our studies.
Okay.
Yeah.
Thank you. That is it from us in Gishu High School. Back to you. We'll keep you posted later.
Thank you, Gabriel Kudaka. Let's now cross over to Migori County. What is the situation there, Bernard?
Well, thank you very much. We are here at Kanga High School. This is one of the biggest schools in this region, that is South Nyanza. And of course, we came here very in the morning. At the main entrance, we can see now students are streaming in, and of course, at the main entrance, we are seeing several water points where each and every student coming in must wash his hands. And of course, we are seeing teachers lined there with the thermoguns. No student is allowed to come in without the temperature, body temperature being taken, and of course, mask. You have to put on your mask. Those who we saw, they were not having masks. Were given the mask, and of course this school is expecting close to 300 students to come back. Teachers are ready here, all teachers, and of course we'll be talking to one of the teachers here. Mwalimu, could you just could you just please tell us what's the situation? Are you ready to welcome the boys?
Thank you so much. I'm Agul Nicholas, serving secretary, Kanga High School COVID committee. We are very much ready to receive students back to school. As you have observed, a number of students have already arrived, and when they reach the gate, we do some contact tracing, ask them a few questions, short interview, the past health history. If they are accompanied by parents, we do the same. And then we take their temperatures as they come in.
Okay, Mwalimu, you've been there before. You've been, schools without school fees, you can't run a school. How are you going to handle this? Because the students were away, and fundings, how are you going to help this situation? Because you have almost 300 students who are coming here.
Thank you very much for that question. Let me take you back. When schools were closed early March, sometime in March, our able principal called for a meeting, and he oversaw this. So he did organize to have some funds borrowed from other school vote heads that is now funding this activity. We didn't wait for the government funding. Actually, we were more ready earlier than any other arrangement was.
So you are good to go?
We are good to go.
Okay, I'll be speaking to one of the students here. Join me here, the last one. Shika. Okay, could you just please tell, were you expecting this?
Okay, thank you very much. My name is Davis Alang. I'm a student and a candidate in this school. To be honest, we were not expecting any of this. We were sure that schools are going to be next year after the long 6 months corona holiday. But we are glad to be back. Well, I was the first student actually to arrive in this school. And when I entered the gate, I found some new development that I did not expect.
Okay.
Like water points.
Okay.
We've sanitized. And I was asked to fill a form, past medical history, which was successful. And I was also surprised to actually find teachers already. By 7 o'clock, the teachers were in,
Okay.
And the teachers are, they're ready. We're also ready.
Okay, thank you very much. Gladys, we've just heard from the student himself there and also one of the teachers there. They are saying that they are all here only waiting for that time so that they kick off with the rest of their lessons. Of course, you've heard from him. They are saying they are good to go. Classes, they are going to divide these classes. You know, remember they are having 300 students, and of course they are going to make sure each and every student is observing the containment measures that were put by the Ministry of Health, as was one of the ways of helping the Ministry of Health curb the spread of COVID-19 in schools. Back to you.
Thank you, Bernardo Juang, speaking to us from Migori County, and we shall continue keeping a spot check across the country even as grade 4, grade 8 and Form 4 students go back to school on this 12th day of October after a long time since the pandemic hit the country. We'll be back.
The pandemic has left more destruction than even the virus itself. Our business is still there thanks to things like EasyPay and EasyBiz. We're moving paperless, we're moving cashless with equity.
Are you looking for the best study opportunity for you overseas? Then don't miss the Uni Abroad IDP Study Abroad Virtual Expo on Monday, 12th October from 10 a.m. to 8 p.m.
When I was in prison, I thought a lot about you.
This is not acceptable!
We know you love milk, and now there is milk that loves you. With Gold Crown lactose-free milk, you can enjoy the richness of natural cow's milk without any of the digestion discomfort. Gold Crown lactose-free milk that loves you.
Dr. Rabbit, is that you?
Yes, it is!
Wow.
I see you're all ready for bed.
I'm supposed to brush my teeth.
That's right! You're really becoming a brushing pro.
Thanks. I have a good teacher.
Get an 8-acre prime residential plot with soil merchants in Kisamis along Magadi Road at 148,000 Kenya shillings for cash buyers or 195,000 Kenya shillings for installment buyers. Come to our open day on 17th October.
Thank you for staying with Your World. My name is Gladys Gachanja. We focus on TB this morning. And remember, the question of the day to you was, have you ever suffered? Do you know anyone who's ever suffered from TB? And what was the challenge seeking treatment for the same? And you are still speaking to us on that hashtag New Normal. Tarus Hazel says, obvious poverty is the mother of all challenges. Transportation fee to hospital is a great challenge. We hear you, Hazel. Penda Paula says, I had TB when I went for treatment. After diagnosis, the attendant was rude. This seems to be coming up over and over again. Samuel Kamau says, treatment duration, yes, it takes 6 months for latent, and active TB could take up to 8 months. And of course, for drug resistance, as we've been told, it could take even longer. The Prince says, I was a victim of 2013. I think we had touched on him after he said he was diagnosed with the same in 2013, but now he has been able to be cured of the same. And yes, TB is curable. Now, let's look at the impact of TB, and especially on those vulnerable communities and those underserved communities. Pamela, you come from Tharaka Nithi. What is the situation in that county in terms of the prevalence of TB?
Okay, thank you very much again. In Tharaka Nithi County, TB is still high in Tharaka Nithi County. And mostly, I think the problem is on contact tracing, because in the community, we only do household visits or household contact tracing. And I believe we should also start social tracing, because mostly the mechanics, maybe the ones they are working with, if there's one person who has TB, and you only go to the person who has TB, you go to the household, you leave the others. So there are known TB cases will still remain in the community. So I think we must find a strategy or a way. We can also start social contact tracing. But I believe I would say it's also be a challenge, because most of the TB patients do not want the people around them to know they have TB. So I don't know what we can do social contact tracing to make us lower the prevalence of TB in Tharaka Nithi County, as also in Kenya. So I think the organizations that deal with TB can also start social contact tracing way, so that we can end TB in Kenya,
Okay.
in Tharaka Nithi County.
We hear you, Pamela, and Elizabeth, maybe you can touch on how this can be actualized, social contact tracing, and also answer to the question as to why there are some counties that carry a burden more than others. Kiambu rates the highest. Why?
Thank you, Gladys. If I can start by just reminding us about the TB prevalence in the country. According to the TB prevalence survey, we had for every 100,000 people, 426 have TB. That's the prevalence. Incident, those are the number of new cases. Prevalence, it includes the incident, the new cases, plus the existing cases. Kiambu has a big population. According to the 2019 notification, Kiambu had around 4,444 cases that were notified. And please let us know that we as a country, we are still missing 40% of people with TB. The ones we notify are far less than the actual number that have TB out there. So Kiambu having a bigger population, you'll expect in absolute numbers that they have a bigger burden. But we use a base population of every 100,000 to be able to compare the burden of TB across counties, across countries, and across even regions. So based on, for every 100,000 population, you'll be surprised to know that county like Mombasa is actually top, ranking top. For every 100,000 people, 308 were notified of TB in 2019. Kiambu, though in absolute number, they ranked second in the country, but going for, as per their population, for every 100,000, they had around 184. Yes. Why why do they have that big number? You know, they say Kiambu, Kajiado, Kitengela, those are the bedrooms of Nairobi. People stay in Kiambu, but they work in Nairobi.
Yes.
Yes, and also we have people going to access, of course, services in Kiambu. You know, our boundaries are actually virtual. You can cross over. So as a country, we in our strategic plan, the TB strategic plan 2019 to 2023, one of our strategic focus is that counties adopt their own response, differentiated response, that are county specific according to their context in responding to TB. So, but one that is universally agreed upon is that we enhance active case finding in our health facilities, particularly including actually the private facilities, because we realize 42% of our patients first seek care for their TB symptoms in private facilities, but they are missed out. They, some even visit facility up to 5 times before a diagnosis of TB is done. So we encourage that active case finding, that is an initiative by healthcare workers to ask for those symptoms of TB, to screen patients for TB, so that any who has any of those symptoms, and we know them, cough of any duration, unintentional weight loss, we have fever, we have night sweats, for children, lethargy, reduced playfulness. So for any of those, then they should be screened for TB and they should get a TB diagnosis. We know, as most of our private sectors, they have challenges in diagnosis, and this is why we're encouraging there has to be investment in diagnostic infrastructure throughout the country. Yes, so to mitigate some of these, we need to allocate money, funds, resources in the fight against TB. Every county in this country has a TB strategic operation framework, which is already costed. We have a budget clearly spelled out with gaps, and the counties can allocate more resources towards supporting the interventions that have been outlined in those operation of framework. And community, let's support also community interventions, yes, initiatives, because we know that our community healthcare workers, they play a big role in fight not only against TB but even against other diseases. And in this era of COVID, we have to equip them, yes, with tools, the necessary tools, with the PPEs, build their capacity, yes, so that they're able to carry out their roles. Not to forget multi-sectoral approach in fight against TB. We have to involve all sectors. The Ministry of Health, other state departments, other arms of government, the civil societies, the community, the faith-based, the private, the implementing and development partners. All of them have a role that they play against the fight against TB. As a country, we are lucky we have one of our parliamentarian, Honorable Mule. He's actually the chair of the TB African Parliamentarian Caucus, actually for TB. And so we advocating that TB should have that priority that it deserves in the country.
Okay, and Lorraine is speaking about priorities, and we have seen the impact of the pandemic on the TB epidemic. How can policymakers ensure that they actually mitigate the gaps that have been created by COVID-19?
Okay, thank you for that question. So one of the key things that as policymakers, public health specialists, and the entire TB fraternity needs to do, and especially because there is a very important role for different sectors, different institutions to come together towards addressing tuberculosis, because this is not just a medical disease. This is also a social disease. As you've heard, it does affect those in the lower socioeconomic status much more disproportionately compared to those who are seeking care in institutions that have diagnostic equipment. And therefore, we have to find ways to ensure that TB is addressed not just as a medical disease, but as a social disease, and also to focus on social determinants of health or of the disease, such as overcrowding, poor housing, making sure that health facilities, particularly the primary health facilities, can be able to screen, can be able to test, can be able to initiate treatment and provide that holistic care for TB patients. So when we look at the COVID situation, we do realize that there have been challenges in that, like we mentioned earlier, a lot of resources have been sort of realigned towards supporting the COVID response. And so because of that, these resources have not been readily available for TB. However, the Ministry of Health, through the National TB Program, is working very closely with her partners, such as the Center for Health Solution and particularly the USAID funded projects like the one that we work for, to ensure that we are increasing demand for TB services, ensuring that there's a lot of focus towards ensuring that Kenyans understand that TB exists, number one, that should you have any of the symptoms that are associated with tuberculosis, you can actually go to a health facility and demand to be tested for tuberculosis. But more importantly, knowing that TB testing is free of charge should allay the fears that sometimes Kenyans have of actually seeking care. And then, of course, being clear that TB treatment is free of charge in all public health institutions, and therefore should one be diagnosed, they can be rest assured that they can get all the treatment that they require for the entire 6 months. And then the other thing is working together to ensure, to ensure that those who have been diagnosed with multi-drug resistant TB actually get follow-up for this, because there are some side effects that are associated with MDR-TB, and this has been supported so that our patients with MDR-TB can actually access this baseline follow-up tests free of charge. So the current situation is that we need to look at the opportunities that have been presented through the COVID response. We know, for example, that there has been a lot of focus on infection control. Infection control for COVID is quite similar to infection control for tuberculosis. And so we have to ensure that we harmonize that so that these resources that are available for infection control can also support TB infection control efforts. Number two, while a lot of focus has been put towards ensuring patients visiting health facilities can be tested for COVID, we need to also make sure that when a patient presents themselves to a health facility with any respiratory symptoms such as cough, fever, and difficulty breathing, for example, that they should also be screened and tested for TB and not just tested for COVID. So actually understanding some of those opportunities that this COVID pandemic has sort of helped us realize, we can ensure that policymakers, health institutions, all sectors can also start harmonizing and aligning themselves to ensure that TB can be supported not only at the primary healthcare level, but also at treatment level for that particular patient.
Okay, now Ben, you have lived experience with TB. You are now well. Let me ask, before you were diagnosed with TB, did you know anything about TB?
Yeah, I associated TB with people with HIV, basically. I used to, if you have TB, probably you have HIV. Or maybe your lifestyle, you have a questionable lifestyle in terms of maybe you're drinking too much, smoking too much, and all of that. So myself was like, even when I got it, I just couldn't believe it. Because I knew I had a set of lifestyle. I'm very strict in what, like I said earlier, I don't smoke. I'm not a heavy drinker. So that was the last thing in my mind, like I have TB.
Okay, Ben, and maybe these as your parting words, what are the lessons you've drawn from your own experience?
First of all, just acceptance. It's not about what happened. Now, what can you do moving forward? Mm-hmm. And first thing I did, the health facility I went to in Kiambu was awesome. I'm reading all these text messages, people saying they had a bad experience. Those guys in Kiambu Hospital Level 5, they're awesome. Dr. Gitaranga Kabogo and his crew and his team, they did a good job. They walked me through the process. I went back to where they zoned me at to go get medication. And all I can tell people is just keep with the process. I know it's 6 months seems a long time, but it's not. Just stay focused with the process of treatment. Eat healthy. Have family support. My sister Isabella Ndegwa, she works in the Kenyatta Hospital. She's in the disease control department. She helped me a lot as well. My dad, my sisters. It's a collective energy from family and friends to help you go through all these processes so you can get better.
Thank you, Ben, for sharing your experience, and definitely the role of community health workers cannot be understated. Pamela, you've worn these shoes for a long, long time. What else can be done to enhance the role of community health volunteers in the fight against TB, especially within the ongoing pandemic?
Okay, what can be done to the community health workers during this time of COVID-19? One, because of the challenges that we face in the community, because of COVID and TB, most of the people are fearing if they are coughing, you might tell them it is COVID. So the challenge is there. We have to be empowered, capacity building for CHVs, so that we can understand more about TB. When you go to the community, we educate them well, because we are well equipped with knowledge of TB. That can help us so much in passing the information to the community. Also, being given equipment like the PPEs, because for the first time when I went to a household for a follow-up contact tracing in the community, I went to know PPEs. I didn't understand well that I should wear a mask. So I went like that, I entered in the room, I talked to the patient, the parents of the patient, and then I walked away again. But I thank God because I didn't get it. But anyone can get it. So I think we should be empowered and also given the PPEs, go around the communities and give the information. Also for screening, we do screening to the community. So we do a lot of work. So we need empowerment to do this. The other lookers, like other workers, even if you have volunteered, we do a lot of primary work, primary health care in the ground, for other diseases and also TB. So more empowerment to the community health workers will do good to us. That is what I think would do well for us as the community health volunteers in Kenya.
Thank you, Pamela, for sharing, and we salute you for the work you do. Thank you for your service. Now, definitely, Elizabeth, a lot of feedback coming through as to first, the kind of reception people get in these facilities when they go for treatment for TB, but also the fact that there are some areas where patients have experienced stock out in terms of the drugs. What's the stand from the Ministry of Health?
Well, let me start with the drug issue. We've not experienced any stock out of medicine. So any county or any person that's experiencing that can get in touch with the sub-county coordinator of TB or the county coordinator of TB, or if they're not able, they can also reach out to us, because so far we don't have any stock out of commodities. Now, coming to the reception that they receive, maybe those could just be isolated cases, but as much as possible, we try to train our staff on how to actually create a rapport with our patient. You know, most of our patients, they go for treatment not for more than 6 months, and there's that relationship that actually they build with the patient over time. So for the isolated cases, it's unfortunate, but we address them as they emerge. It can also be escalated at different levels. Yes.
Okay, and you heard Ben was saying he did not know much about TB until he was diagnosed with it. Will we be seeing more awareness campaigns coming out in as far as TB is concerned now that we know about the impact of COVID on TB?
On TB, yes. And then we've seen the impact, actually awareness that has been created by media on just spotlighting COVID-19. And I believe that, Gladys, if the media took the TB issues as seriously as they have done COVID, then we'll not be talking of ending TB in 2030 or 2035. We'll be ending TB even in less than 5 years. So awareness creation is very, very key in creating actually demand and making just people know that TB exists, but TB can also be prevented, TB can be treated, and TB is curable. Also to let us know that in the screening initiatives, we have innovations. We have like automated machines where you can go and self-screen. They're available at places like Huduma centers in Kibra. We have the use of USSD, yeah. So any phone, be it Mulika Mwizi or the smartphone, you can use any phone, you can use it to self-screen. There are instructions that are given as you dial that particular code that you've been given, and it's free of charge. Yeah? You're not charged anything for sending that that text. That's one way of creating awareness, ensuring that people actually are screened, and we bridge the gap. We close the gaps in missing people with TB. Because if we don't find them, then the TB transmission will continue in the community.
Very true. I thank everyone who was part of this conversation this morning for giving us more perspective in as far as the situation of TB in the country and, of course, the impact of COVID-19. On the same, Dr. Elizabeth Onyango, who is the head of the National TB, Leprosy and Lung Disease Program at the Ministry of Health. Dr. Lorraine Mugambi, Chief for Party USAID TB ARC2 Center for Health Solutions. Pamela Njero, who is a community health volunteer from Tharaka Nithi, and of course Ben Degwa, who gave us his experience living with TB for the 6 months that he actually got treated for the same. Thank you all again, and tomorrow we shall be joining you on a conversation that most people shy away from, but it is part and parcel of wellness. We're talking about prenatal health and fitness. We shall be understanding the importance of the same, how you can do this to ensure that you do not put your pregnancy at risk, and while at it, what kind of nutrition should you be looking at? All those questions will be answered tomorrow. See you then.
I help women find independence by training them in fish farming. It's tough on my back, joints, and can cause headaches. Panadol Extra relieves multiple types of pain.
If symptoms persist, seek medical advice.
Jack Bogosian, you're on the air.
Why did you quit?
Why did I quit what?
The agency, Jack.
I stopped believing in lies.
We should have stopped!
Your company
killed my family, killed my entire town. You will remember them.